medical community and to the healthcare career field. So again, we celebrate our physician's assistants and thank you. Even though it's belated, we're grateful that you exist because doctors need all the help that they can get, and the technical experience of the physician's assistants, along with the nurturing and health care of our nurses, keep us all healthy in our communities. So we want to thank you all. And with that, I want to turn the mic over to another esteemed member of our SCEDA board, another person who's near and dear to my heart. We love her, and we thank her for coordinating and putting this presentation together today. Our Health Actions Committee Chair, Dr. Wilhelmina Taylor. She is a clinical pharmacist in Washington, D.C. and Maryland. She received her doctorate of pharmacy from Howard University College of Pharmacy in 2002, and she has served patients for 18 years at Providence Hospital and 18 years at the Giant Pharmacy. She currently works with Giant Pharmacy as the manager. She is a certified diabetes trainer and certified immunizer with the American Pharmaceutical Association. Dr. Taylor is a healthcare advocate who enjoys serving her communities and she likes to teach. So this is right up her alley today. She is committed to making a difference and helping her patients with a better quality of life. So thank you, Dr. Taylor, for what you do. Thank you for moderating today. And ma'am, the floor is now yours.
Thank you, Tanya, for those kind words. I appreciate you. And I want to thank all of our panelists that are here today. I know you could have been doing something else. So we really appreciate all that you do for our community, families, and friends. I want to start out by introducing our list of panelists. First, we have Ms. Leslie Jefferson. She's a licensed certified nutrition specialist and a nutritionist with Giant Food. Leslie has a Master's of Science in Nutrition and Integrative Health from Maryland University of Integrative Health. She is able to provide a functional and integrative approach to nutrition education with a goal to help you add nutrient-dense foods to your diet. You can join Leslie in online classes or one-on-one consultation with Giant. Leslie she can show you how to learn how food impacts your wellness journey. She is happy to help you meet your health and nutritional goals with tips and strategies that fit your lifestyle. So I want to thank Leslie for joining. And next we'll have, after Leslie speaks, then we'll have Dr. Vanessa Allen. And Dr. Allen received her medical degree from Howard University College of Medicine in 1989. She completed her residency in family medicine at Duke University Hospital in North Carolina. After completing her residency in 1993, she started a successful group practice in Fort Washington before opening her own private practice in Glendale, Maryland. In Dr. Allen's search for knowledge, she moved beyond her training in traditional allopathic medicine to embrace integrative, complementary, and alternative medicine. She has continued her education in complementary and integrative medicine by completing coursework with the University of Arizona Department of Integrative Medicine, chaired by Dr. Well, and has studied and mentored with Dr. Akmal Muwakil, who specializes in herbal and Chinese medicine. Dr. Allen has completed her study in acupuncture at UCLA in the spring of 2006, and this is the leading center for physician training in acupuncture. She is affiliated with the Institutes of Functional Medicine, an integrative approach to chronic disease management, Association of Lifestyle Medicine, and American Academy of Family Medicine. Dr. Allen also wrote a book. It's called The Natural Way. It's a natural approach to weight loss. Dr. Allen believes in patient-centered care and addresses healthy lifestyle issues, focusing on nutrition, physical activity, mind-body approaches, and spirituality. Her goal is to promote wellness and disease prevention that enables patients to increase control over their health and improve their health care. Next, we had Dr. Vanny Taylor, who's a dentist. He was going to talk about oral hygiene and the importance of oral hygiene during this pandemic. But unfortunately, he couldn't make it today. So he said he looks forward to doing future seminars with us. Following Dr. Allen, we will have Dr. Sandra Banks, and she is a board certified emergency medicine physician currently practicing at Doctors Hospital in Lanham, Maryland. Dr. Banks received her Bachelor of Science in Microbiology from the Ohio State University of Pittsburgh Medical School, and she graduated with her medical degree in 1997. She was the proud recipient of the Navy Health Professional Scholarship and did her internship at National Naval Medical Center in Bethesda, Maryland. After serving 3 years active duty in the Navy as a medical officer, she attained the rank of lieutenant commander before honorable discharge. Her residency training in emergency medicine was at George Washington University, and Dr. Banks has been an attending physician since 2004. She is currently medical director and co-founder of Plan Ahead Foundation, whose focus is on testing and educating in diabetes, hypertension, and HIV in underserved populations. And last but not least, we have Dr. Donwa Simpkins. She is a general anesthesiologist in Annapolis, Maryland, and the United States Navy Reserves. She has provided care in the intensive care unit and operating room to patients with coronavirus. She believes that this pandemic is a shared experience. We can do simple things to protect ourselves and our community. When she is not working, Donwa is enjoying life with her husband of 2 years, Keelan. So I just want to thank you all for taking your time out today to be with us and to give us very critical information that will help us to get through this pandemic. And we titled it Combating COVID-19 because we want to say that we are going to take the necessary precautions to do what we need to do and to prevail over this pandemic. And I just wanted to start out and just give a little brief overview about COVID-19, and then I'll let our panelists give a further discussion. So COVID-19 is a disease caused by SARS coronavirus 2 that can trigger a respiratory tract infection. And it can affect the upper respiratory tract, which consists of the sinuses, the nose, and throat. It also affects the lower respiratory tract, which consists of the windpipe and lungs. There are several strains of coronavirus. So coronavirus is not old, but COVID-19 is a new or novel coronavirus. We have had several different strains of coronavirus. For instance, we've had sudden acute respiratory syndrome, that is SARS. We had an outbreak back in 2002 to 2004, and that was from one of the family of coronaviruses. We also had Middle East respiratory syndrome, which was referred to as MERS in 2012, when we had an outbreak, and the first case was reported in Saudi Arabia. And we also have other coronaviruses that we deal with throughout the whole year, such as the common cold, but it's not as severe as COVID-19 and SARS or MERS. So how do we combat COVID-19? One of the most important things, besides doing our best practices, is to boost and strengthen our immune system. And if we boost and strengthen our immune system, we will be able to fight COVID-19, we'll be able to combat it and become victorious. So that is what our panel discussion will be about. And all of our panelists will give information on best practices of combating COVID-19. So we know that we have to social distance. We need to maintain a 6-foot distance. We need to wear our mask over our nose and mouth. I can't tell you how many people I see that have their mask underneath their nose. We have to make sure that we cover the nose and the mouth. And also, for added protection, You can have your eyeglasses, some type of eyewear to protect your eyes from the exposure of the virus also. Cover your coughs and sneezes. Um, when you cough or sneeze, make sure you cough or sneeze in a napkin or in the inside fold of your elbow. And once you do that, throw away your napkin and wash your hands. It's very important to wash your hands. We say that you can sing the happy birthday song, but at least wash your hands for 20 seconds and wash your hands thoroughly. Also, we need to continue to clean and disinfect frequently touched surfaces where we can pick up the virus. We need to monitor our health on a daily basis. And we also say if you are sick, please stay home. If you have severe symptoms such as loss of taste or smell, difficulty breathing, different things like that, you need to contact your doctor, and then they'll advise you on what to do. So I pulled up some stats, and according to the stats from yesterday, the number of cases in the United States are, let's see, we are at 7,958,254 cases of COVID-19. Within the past week, the new cases that we have were 63,486. So a total for the cases in the last 7 days, it totaled up to 375,244. Unfortunately, the total deaths were 216,917. And so in the state of Maryland in the past week, we had 4,170 cases. District of Columbia, we had 401. And in Virginia, we had 7,475. So as a pharmacist, usually what I recommend to my patients is that they have to exercise. Exercise is very important. It helps with your immune system. It helps with you as a person as far as relieving mental stress, because a lot of people are stressed out about the pandemic, about the situation. I also suggest to my patients that they need to pray and meditate. Right now, we do not want you to be fearful of this virus, the pandemic that we're going through, but we want you to be educated and to be cautious. And I always tell people to respect the virus, wear your mask, do all of the necessary things that we need to do to protect yourselves, your family, and your community. Also, I recommend to my patients to do a nasal rinse. You can do a nasal rinse to help rinse out the nasal passages. I also recommend that once you come from outside, that you change your clothes, take off your clothes and go and shower, put your clothes in the washer and, wash them. And a lot of times we as pharmacists, we give a lot of medications, but we also ask that the patients take different vitamins and supplements. So in order to help boost your immune system, we recommend that they take vitamin B complex. Vitamin C is one of the biggest immune system boosters. So we recommend that also. We recommend vitamin D. Vitamin D helps balance out the cytokine storm that's going on. The patients are experiencing massive amounts of immune response where their body is telling the T cells to come out and fight or combat COVID-19, attack the virus. And sometimes the immune systems are overstimulated to the point where it seems as if their body starts attacking themselves. They're attacking the virus, but there's an over-exaggeration. So with a normal level of vitamin D, you can help balance that cytokine storm that's going on inside of the patient's body. We also recommend vitamin E. That's one of our powerful antioxidants that helps the body to fight off infection. Selenium is another mineral that will help to boost the immune system. And zinc is one other vitamin that we recommend that helps to keep the immune system strong. It also plays an important role in the inflammatory response that's going on. And as far as pharmaceuticals, if a patient is experiencing fever or pain or some type of discomfort, we will recommend aspirin. That helps to reduce the fever, body aches, and aspirin is also used as a blood thinner. We noticed that a lot of the patients that were presenting had blood clots, whether they were on the micro level in small vessels or in larger vessels. For fever and pain, we recommend Tylenol, and we also recommend Motrin. There was a big debate about whether to recommend Motrin or ibuprofen to the patients earlier during the pandemic. And they realized that Motrin is effective. So they said at first they were suggesting do not use Motrin, but you need to use Motrin to help break a fever, especially if there's a patient, if you have a child or adult that has a fever over 100 degrees that you cannot break, you need to alternate with Tylenol and Motrin every 4 to 6 hours to help break that fever. Some of the other medications that have been prescribed are chloroquine, hydroxychloroquine, and those are anti-malarial drugs. So right now they're trying to use different drugs in different patients to see what works and what is helpful. Azithromycin is one of the antibiotics that we use to help treat, I'm sorry. Azithromycin is one of the antibiotics that we use to help treat not the virus, but a bacterial infection. So a lot of times when the patients have COVID, they will have complications such as pneumonia. They may have sinus infections. So when you're prescribed azithromycin, that is to treat the bacterial infection, not the virus. And you've heard a lot on the news about remdesivir. That's one of the emergency use authorization medications. That is an antiviral that's used a lot of times in the hospital, and I'll let the panelists discuss that. That is one of the drugs that they're using to help with COVID. Another recommendation that I would recommend for my patients are to have their vaccinations. It is very important that you get your influenza shot, which is your flu vaccination, and your pneumonia vaccination. For all adults 50 and over, we're recommending that you have your influenza and pneumonia. We have two different vaccines. We have the Pneumovax 23 and we have the Prevnar 13. Normally with the Prevnar 13, we give that once a patient turns 65 and older, and then 12 months later, we'll give the Pneumovax 23. And that has shown to help rule out at least flu symptoms so that you'll know exactly what's going on. And we also recommend other vaccinations. So during this time, it's very important that you stay healthy, exercise, prayer, not be fearful, just be positive and try to enjoy life as best as you can. Be creative, respect the virus, wear your mask, and maintain a 6-foot distance. Okay, so now I will turn the panel discussion over to Ms. Leslie Jefferson, who's a nutritionist with Giant Food. Thank you, Leslie.
You're muted, Leslie. Can you unmute yourselves?
Thank you. Zoom protocol 101.
Yay.
Yay with Zoom. All right, my name is Leslie Jefferson. I'm one of the nutritionists with Giant. So if you didn't know, Giant does have nutritionists to help you with a variety of health-related topics and information. I work frequently with Wilhelmina. I would consider us a dynamic duo for Giant.
Yes.
So I'm going to share my screen. Let's see if we can make this happen. All right. So I'm going to piggyback on a few of the things that Wilhelmina discussed. Of course, we had a little powwow prior to. So nutrition and COVID is so important to make sure that you are keeping yourself in line with a balanced plate. So a lot of the vitamins and nutrients that Wilhelmina discussed in her presentation, you can achieve this very simply by keeping your plate balanced. And that is always, always, I would not be a nutritionist without saying so. Half plate produce, that is your fruits and vegetables, keeping quarter plate grains and quarter plate protein. So with these nutrients and your macronutrients, these are your carbs, your proteins, and your fats, keeping them all together in a balanced plate will ensure that you're getting all the nutrients that you need, and having a variety of fruits and vegetables on your plate also ensure that you receive the phytonutrients, the macronutrients, and your micronutrients. So your minerals, your vitamins, those are all your micronutrients. So it's important to get a variety of fruits and vegetables and different foods on your plate. So I'm going to give you my top 5, your top 5 things to get on your plate when you're trying to balance nutrition and COVID. So my top 5 is my number 5 is vitamin D. So, they call it the sunshine vitamin, but it supports so many of our body systems. And when we're talking about infection, and we're talking about upper respiratory and lower respiratory diseases like COVID, it is important to make sure that we are taking care of all of our systems. And vitamin D is a sunshine vitamin. And one of the things that is happening now is that we're indoors. We are not outside as much. We're not doing the things that we're normally doing. Some of us are working from home. So you're not even walking back and forth to your car as you normally would. So it's important to get some sunshine. Go out for a walk, as Wilhelmina discussed, getting active. And vitamin D supports so many of our functions. And when we talk about immunity, it helps to activate a lot of those cellular reactions that our bodies need to do the work that our body needs to do. So vitamin D is one of the most prevalent deficiencies for a vitamin. And our bodies cannot make vitamin D. We can only get it from the sun or food. So when we talk about going outside, our vitamin D comes in through our skin. And if you have darker skin, that also promotes a little bit of a challenge because it takes a little longer for the body to convert the vitamin D and create all of the processes that are involved. And vitamin D is created in the gut, and we're going to talk about that a little bit too. So the gut plays a huge role in the conversion of vitamin D. So we need to make sure that we are keeping our gut healthy. So vitamin D is important. So I wanted to just really talk about how much we need. We need about 600 to 800 IUs. Some of us may be taking maybe visiting our pharmacist so that you can get a prescription for vitamin D. But generally, we need about 600 to 800 IUs a day. And that really converts to 15 to 20 micrograms per day. So how do we know what we're getting when we're talking about food? There are 2 types of vitamin D. There's vitamin D2, and that comes from our fortified foods and plants. And then we have vitamin D3, and that comes from our fatty fish and the sunshine. So there are 2 ways to get your vitamin D. So when you're trying to look for the fortified foods, you're shopping, you got this diagnosis that your vitamin D was a little low from your lab results. You may say, how do I know how much I'm getting? So we look at the nutrition facts on our food label. Now we had an old version, and our nutrition facts labels are now updated. So we used to have tons of vitamin A, vitamin C. We used to see these different vitamin A and vitamin C on our list now, but now that is no more. That nutrition fact label is gone. Now we have vitamin D listed. as one, because we found that that is a source of deficiency. We are not deficient in vitamin C. We're getting enough of that in your daily diet, but we are not getting enough vitamin D. So now it's been added to our food labels. And as you can see, it breaks it out into the micrograms. So 15 to 20 micrograms per day. Maybe this is a cup of milk, 2/3 cup of milk. I don't know what this item is, but it has 2 micrograms in this serving size. So you can kind of manage how much you're getting through the course of the day and the different fortified foods that you're eating. So what does that mean, a fortified food? Your fortified foods are generally things like milk and things like kefir. If you think you're getting it through yogurt, yogurt is not a fortified food because it would mess with the consistency of the fortification, mess with the consistency of the yogurt. But our cereals are fortified, and so are some beverages, non-dairy beverages. We would normally get our vitamin D directly through foods like tuna and salmon, fatty fish, mushrooms. Mushrooms are very interesting because they're grown in the dark and they use the UVB rays to grow the mushrooms. So when the mushrooms get that light, it creates a source of vitamin D. So eat some mushrooms. Put it in your omelet. All right, number 4 is crazy for vitamin C. So of course, vitamin C, everybody knows, we have vitamin C, it boosts your immunity. And our bodies, it's another vitamin that our bodies just can't make on its own. It's a water-soluble vitamin, so you can pee it out. So you need to have enough in your system. But just keep in mind, if you get COVID, just because you take the vitamin C is not going to make it go away. You still have to take care of yourself during the course of an illness so that the illness can run its course. But taking vitamin C won't say, it's going to go away now, I'm taking that. So please keep that in mind, that you still have to take all of the precautions that Wilhelmina talked about in advance of our programming here. So some foods that you may not think are high in vitamin C is not all about citrus. It's not all about oranges. Cabbage is an item that's very high in vitamin C. And our number 1 item, usually on most lists, are peppers. So yellow peppers, red peppers. That speaks to the color and variety in foods that you should have on your plate. So it's not always just oranges and lemons. There are a variety of foods that contain vitamin C that are very helpful. I put the applesauce on here because they will add ascorbic acid to the applesauce. So if you have someone that's older and unable to chew certain foods, applesauce is a good way to get in, or kids or babies or, that are unable to chew. Applesauce is a good way to sneak in some of that vitamin C. Number 3, protein. Got to get that protein in so you can stay strong and help to fight off the infection, because our body uses protein to repair, and it helps to keep us strong. It also helps to keep you full and satisfied so that we're not snacking on a bunch of different other foods. That's been going on a lot during COVID. There's a lot of snacking. So you want to make sure you stay full and satisfied. And protein does that for us. It could be a plant-based protein. It could be eggs or yogurt. It could be fish, nuts. But just be careful with your nuts, because sometimes we tend to eat a lot of nuts and then we're not hungry because of the fats in the nuts. So if you find that over the course of COVID, you've been at home and I'm going to eat a healthier version of some snack and it contains nuts, well then if you eat a lot of nuts, it may take away from your meals later on in the evening. So if you're be mindful of that and note what you're eating during the course of the day. So we want to also include the protein because that zinc is included in a lot of the proteins that we're looking for. So sometimes our organ meats, things like oysters, are high in zinc, but a lot of our proteins are high in zinc. So we want to make sure that we're getting that in during the course of our meals as we plan. And you want to have a protein and a fiber together at every meal. This will help keep you full and satisfied. This will ensure that you're getting a balanced plate. So treat your snacks the same way. Have a protein and fiber at every meal. Number 2, water. Gotta drink your water. Gotta get your water in all through the course of the day. It helps to keep our mucous membranes moist, helps to keep our joints mobile. We are sitting a lot. We're going from the small box to the larger box, the TV. So we're not moving as much. We might be at home, all day long and then go, oh, I haven't been outside. So what we want to do is make sure we're moving around, but staying hydrated as much as possible. And coffee consumption has gone up about 30% over the course of COVID because people are at home. So has the intake of adult beverages over the course of COVID. So these things can be dehydrating. You want to monitor the amount of sweetened beverages you take in. So I always try to recommend, if you're going to go in and have certain items, have 1 glass of water and then have 1 glass of whatever you're going to have of that item. So make sure you're adding in that water. And then wearing a mask. If you think about when you go out and you're wearing a mask, you're not, and you may carry a water bottle with you, but during the course of having the mask, you may not drink as often. So it can dry out your mouth. It can cause you to be a little more, I don't like to use the word dehydrated unless you're really dehydrated, but it can cause you to take in less water. So you want to be mindful that you do take those opportunities to go to the corner, move down the mask, take a sip, and then continue on with your activity. Because when you wear the mask, you kind of feel like, oh, I shouldn't take it off, but you may normally drink more water. The mask could be causing you to drink less. So keep that in mind. If you feel that your lips are getting dry, your mouth is dry, you should stop and have water. So water, it comes in different forms. So it doesn't necessarily have to be water. I know some people don't like it. So you can get some sparkling water. You can use teas. So I love to use just regular tea, and because they have so many wonderful flavors now in tea. So you can get like an orange tea, you could get a berry flavored tea, and you can maybe add that to a water bottle and carry that around. And then you can sip and it has some flavor to it. You can infuse your water. I have some kiwi in my water today. So you can put infused items in there. You can have things like kombucha. As long as it's lower in the sugar end, it gives you some more flavor. So if you're not a water drinker, things like bone broth are great too. You can use a vegetable broth. You can use a chicken bone broth. Those also are helpful to the gut, and they have flavor. So you want to stay hydrated, not just one way or, with water or soda or juice. Mix it up a little bit and make sure you're getting in enough water. Hot beverages are great also because it's comforting and it helps to keep down stress. So it's important to kind of mix it up a little bit. Well, my number 1 is prebiotics. I would not be a nutritionist if I did not say at least once, eat your vegetables. Eat your vegetables. Eat your vegetables. And I would say, every meal have a vegetable. Yes, even breakfast. Sweet potatoes are the muffin of the vegetable world. So I would say have a vegetable with every meal. because it creates a prebiotic environment, because that's where your fiber comes from. A lot of your fiber comes from your fruits and vegetables. It also comes from whole grains. So when you think about what a prebiotic is, it's food for your gut. So the microbes in your gut have to have good quality foods to do the work that they do. We normally think of probiotics, but that's kind of after the fact. So you want to stimulate your gut so that the immune system, that is basically where it starts, in the gut. So when we're looking at foods to help with your high fiber, we want fruits and vegetables, we want whole grains. I never do a presentation without talking about broccoli slaw. Broccoli slaw is an easy way to get in your vegetables. If you're not a vegetable person, or you don't feel like cooking, or we're at home, we need a quick meal, the broccoli slaw can easily fill in with smoothies.
Mhm.
It can quickly be sprinkled on for salads and make a very quick salad. If we're getting warm now, you have a soup that you like. And I like to say that chicken noodle soup has 1 carrot floating in it. There's no vegetables in chicken noodle soup. But if that's something that you like, and especially if you're trying to recover, you have chicken noodle soup, a little sprinkle of broccoli slaw, nice shaved vegetables, very thin, break down easily, easily chewed, easy on the digestive system. And it can just go into anything. If you like rice and you're trying to get more vegetables in, you can slide in a little broccoli slaw in there, saute it up, and you add more vegetables to that. Because the fiber also helps you to keep full. You get lots of B vitamins. Remember earlier we talked about a B complex vitamin. So now you're getting that from your food. It helps you to create the energy so your cells can work more efficiently. And then that helps with recovery. That helps to fight the infection.
Mm-hmm.
And then we want to look for items that are whole grain items. Whole grain items have a lot of fiber, and you want to look for items that have the whole grain stamp. So if you like crackers, that's fine. Look for crackers that have the whole grain stamp. Items like quinoa. Wouldn't be a nutritionist if I didn't say quinoa at least once. So we have quinoa that has high in fiber, high in protein. Getting your protein and your fiber together. And if you don't like to cook these things, you can get them already prepared and microwave them up. So you don't have to worry about, oh, I don't cook it properly, it's too sticky, or I never get it quite right. You could purchase items that are already cooked, throw them in the microwave, and you're good to go. Even for breakfast, you can have wonderful whole grain breads that have wonderful taste. You can pair it with a wonderful omelet. You get some protein, throw some spinach or broccoli slaw in your omelet, and now you have a well-balanced meal that's high in fiber. And finally, you just want to stay, as well as you can. Keep that mental and physical wellness front of mind. Eat a balanced plate. Keep moving. 30 minutes of movement a day. You can break it up in 10-minute segments. You don't have to be Arnold Schwarzenegger in the gym or LeBron James running up and down a basketball court. You can just take the steps. Or if you're at home all the time and there's a bathroom close by, go to the one upstairs. Do a little bit more moving in your day, because we can get bound up. Some people aren't, they're experiencing digestive distress because we're not moving as much. So your body needs movement to move. It also needs fiber to move. So if you find that things are a little bit, stuck, try a little bit more movement. And this also helps with your mental awareness. You want to stay connected with friends and family. You want to take time out for yourself. Like Willamilly said, be creative, try something new. It's a time to explore and a time to reflect also. So we can take a positive spin on this. So that is my time. If you ever need a nutritionist, Giant provides nutrition services. We do one-on-one consultations. We have tons of classes, and we do wellness events for organizations. So we provide videos. We can provide webinars for your business and for your employees, because we're all about making sure that our community is healthy. And I generally work in Prince George's County, and I'm happy to serve the residents in Prince George's. So that's my info. You can reach out if you ever need anything. That's my time.
Thank you, Leslie, for a wonderful presentation. Now we will hear from Dr. Vanessa Allen.
Morning.
Good morning.
Everyone.
Great.
So I'm a family medicine doctor, and I'm in private practice. So, we had to make a lot of changes with the coronavirus, from operating as in an office to doing telemedicine. So, they've always asked us to embrace telemedicine, but we were just kind of reluctant because it's another task to do. But, when you have to do things, you have to do things. So I have a whole lot of new skills that I didn't have before. And, around telemedicine, and, how do you convey that, I can still know what's going on with you without actually touching you. So that was something new that we had to do as, transitioning into our new pandemic. So when everybody pretty much went home in March, we had to determine, like, how are we going to change the way we practice medicine? And I was thinking, oh, we'll just be home for a month, and then we will transition back into the office, not knowing that it's still going on. And, we're kind of doing a hybrid of things. I went back into the office last month, about 3 days a week, and I was surprised that my seniors really wanted me to come back in the office. And I'm like, I'm doing this for you. I'm staying home so that you all don't get sick. And no, we need you to come in. We want to be seen in the office. So, trying to accommodate everybody's wishes and then still stay safe has been a challenge. And so, since you all are pretty much covered all that preventive aspects about food and nutrition and supplements and things like that. So I'm going to focus on something a little bit different about, how to stay safe. And, like I was listening to a webinar the other day about the vaccine safety coming up, and, a lot of questions about how is the African-American community going to participate with that. So, even when, I guess maybe about 10 years ago, when they made an addition to the flu vaccine, a lot of my patients were resistant to receive the additional dose. And I had, the county gave it out for free, and I had all these vaccines in my refrigerator, but nobody to give it to. And so I anticipate that's probably what's gonna happen when the vaccine comes out for the coronavirus. So how am I gonna make my patients feel comfortable and myself feel comfortable that it's okay to get the okay to get the vaccine. So with that being said, they are looking at the social dynamics and social economic disparities in our community about, who's being affected the worst by the virus. Of course, the brown and Black communities. And then who's most likely to not trust it, the Black and brown communities. So when it first comes out, there's not going to be enough for everybody to get the vaccine. And so they want to focus on the people who are most at risk. And of course, that is us. And then we're the ones who are like, not doing it. And so, it's kind of like, how do you make that bridge? So that's a challenge that I see coming up as the vaccine's getting closer and closer to development. Now, some of the trials that have been going on, there's about 3 major trials that are going on, and, trying not to make it political, which now it is very political, and the more political it gets, the less people are comfortable with receiving the vaccine. But, I think that is the most looked at trials as far as like science trials and getting people involved. It's highly regulated, more so than say maybe another drug might slip under the cracks or slide in relatively easily. So once the vaccine is going through the trials, they have committed to saying like at least 2 months are going to go by after they receive the trial period, so that to ensure that are there going to be side effects going on with the vaccine after it's administered. And so with the 3 trials that are going on now, one is like a one-time, and maybe 2 are one time, and then one of them is you have to maybe do a booster. And then since the coronavirus does change over time, they're not really sure. Will you have to do something every year like the flu vaccine? You have to get a new vaccine every year. Are you going to have to do the same thing with the coronavirus as well? And once you get the coronavirus, it doesn't mean that you're immune to it for the rest of your life. You might get re-exposed again and get sick again. So you have to be aware of that, that it's not a one-time thing. If you should get the virus, that you can't get it again. And then I think that now in my practice, I'm not seeing as much positive coronavirus as I used to, but I do see now that, you know, people are a little bit more comfortable around it, and young adults are going out more, and then they come back home and then they infect the adults, whether they're 50 plus or their grandparents. A lot of people have multi-generational families, so their grandparents are getting sick or their parents are getting sick, but the younger people might get sick, but not as bad as their older relatives. So I have to be constantly mindful about that, even within my own house, where my kids are coming and going and I'm pretty much staying home. So, you know, you were like, where did it come from? It came from them, or, you know, the places they go, and trying to get them to realize that even though they might hang out with the same people all the time, you don't know what they do when they're not with you. So that's a concern that you have to be constantly diligent about. Even with your own children coming in and out of the house or coming to visit you, you have to be diligent to them as well. And, you know, we did spend some time talking about the racism historically related to administering healthcare and the trust that people have in the viruses. So as far as like vaccine and how do you get exposed and who do you trust, who you don't trust. And so I have to be really consistent about saying the same thing, messaging the same thing every time. Because a lot of people say, what are you going to do versus what they might do? So, you know, you have to set the example. And I think that's what's so frustrating now, especially being in the capital area, that the example is not what we want to see represented. And it's very frustrating if you don't do by example, not do what I say, but don't do what I do. So that's very frustrating as well. So those are some of the challenges that I have experienced, you know, in private practice and in, you know, like getting the word out, because in Prince George's County, even though the state is back open, the rate of coronavirus is still very high. And then there are pockets of areas where it's higher than others by zip code. And there are, you know, sites you can go to within the Maryland .gov site about coronavirus that'll tell you by county who has the highest numbers. And so I look in my, you know, 10-mile radius, and I'm still, you know, some of those zip codes are like 2,000 plus as far as infection rates, where some are down to less than 500. So you still have to be very diligent, even though you don't know personally someone who has it. There are people out there who are still getting sick. So you always have to keep your guard up until there is a viable vaccine. So that's pretty much what I, you know, have to say on the matter of the coronavirus.
Okay, thank you, Dr. Vanessa Allen, for a wonderful presentation. Next, we will have Dr. Sandra Banks.
Good morning, everybody.
Good morning.
So I'm probably going to touch bases on, I think, a couple of things that Wilhelmina said and a couple of things that Dr. Allen said as well. I'm going to go back over in terms of the cases internationally, nationally, and here in Maryland and PG County. The latest figures globally for the pandemic is 38,750,000 cases worldwide. It's approximately 1 million deaths worldwide. But the US has a disproportionate number of cases. The last figures that were released on Wednesday was 7,947,000 cases as of October 14th, with 217,832 deaths alone, which is pretty high compared to the worldwide figures. So we are not leading the way in terms of treating and tackling this pandemic. For Maryland alone, there's been 135,000 cases with 4,000 deaths. Prince George's County is the leader of cases and deaths. With from this past week, it was 31,582 cases in Prince George's County with 841 deaths. Now, the news has been showing that the cases have been increasing. I know personally as an ER doctor that we are seeing more cases that are coming in through the front door via ambulance. It's still disproportionately affecting African Americans and Hispanics. And the question is, why are Black Americans and Hispanics more likely to get this virus? Black Americans are 4.7 times more likely to be hospitalized and 2.1 times more likely to die compared to non-Hispanic whites. Hispanics, similar stats, 2.8 times more likely to contract the virus and 4.6 times more likely to be hospitalized. One thing that certain studies have looked at is who's getting tested and what areas are they getting tested in. Areas that get more frequent testing are actually areas that have less Black and brown populations. And so the key to treating and preventing COVID is to test, to know numbers. So if you know you're affected, you're more likely to stay at home and self-isolate. So if you don't know, you can't get treated, especially when people have symptoms. Blacks are more likely to be diagnosed in the hospital instead of outpatient testing. And so if they're in the hospital, they're already symptomatic. I think somebody talked about the symptoms. I think we all know the symptoms: fevers, chills, cough, sore throat, lack of taste, smell. Some people have no symptoms. Children do get COVID and they pass it on. So that's one of the things that we're concerned about now with kids going back to school is, are they passing it on amongst themselves but not having symptoms, but they go home to their parents, their grandparents, and passing it on to them. Why are African Americans and Hispanics also more likely to contract COVID? It's been linked that we are more likely to get COVID because, one, we have increased numbers of pre-existing conditions like high blood pressure and diabetes. And we also have higher diseases that are not being treated properly. So worsening or chronic medical conditions. And so those are risk factors to getting worse cases of COVID and even death. Our communities, again, we were saying not being tested. So if you're not being tested, you don't know you're going to pass it out into the community. We're also increased risk for frontline healthcare workers. So frontline healthcare workers are nurses, doctors, but also security, housekeeping, registration, radiology techs. They're at increased risk of coming into contact and developing COVID. So what can we do to try to limit who gets exposed to COVID? So it's nice to say everybody stay home. If you stay home, you're less likely to contract COVID. But of course, people have to work. People have to go outside and get their necessities. So what can you do when you go out into public to try to lower your risk? One is mask. Now, they recommend for the general public to not wear surgical masks or N95 masks. They should be left for people that are frontline healthcare workers. But a 2-layer fabric mask is what actually the CDC recommends. Proper mask wearing. So as Wilhelmina said, not under your nose, not under your chin, but up over your nose, snug fitting, and down under your chin. The CDC recommends anybody over the age of 2 years old wear a face mask when they're out in public. Gloves, should people wear gloves out in public? That answer would be no. When you go out to the grocery store, you see people wearing gloves. So actually increases your risk of cross-contamination. You see people wear the gloves, they go in, touch the keypad, they touching vegetables, and then they come back inside in their car or their house with the same gloves. So they're actually increasing their risk of contacting COVID by cross-contamination of the surfaces that they touched. Frequent hand washing. You touched on the frequent hand washing. And frequent hand washing meaning with warm water and soap, washing your hands for at least 20 seconds, or using hand sanitizer if you're not able to wash your soap. And the hand sanitizer has to have at least 60% isopropyl alcohol to be effective in killing germs. And being socially responsible. So socially responsible, if you're out in public trying to maintain the 6 feet space. And the reason they said 6 feet distance, because they think that's the distance where respiratory droplets are less likely to affect somebody else. And we're concerned about respiratory droplets because that's how COVID is mainly transmitted, is by respiratory droplets. And so respiratory droplets for somebody for talking, sneezing, coughing, laughing, smiling, that's how the respiratory droplets come out. And so we wear the mask not to actually prevent you from getting the disease, but for preventing you from spreading the disease to somebody else. What else? In terms of exposure, they said the increased risk now of exposure is not actually the large gatherings and crowds, it's actually small household gatherings. So people that are in your inner circle that might have been in contact with somebody else, and they come over to your house or to your small gathering, and they don't wear masks because that's my family, that's my friends, and they're actually giving it to you, and then you're giving it to somebody else. So they said that's actually what's leading some of the numbers for COVID exposures, small household gatherings. The governor, and I think nationally, they were talking about who should wear masks in terms of public transportation. And so they did not mandate that people wear a mask during public transportation, which I think is a serious mistake, because public transportation is buses, trains, the metro. And so you're in an enclosed space that's poorly ventilated. And so I think that's going to drive up the COVID numbers as well, because you can come onto a train or a bus and you don't have to have a mask on. So I think the most important thing is just you, as being out in public, should just be responsible, try to self-isolate. When you go out in public, try to limit the time that you're out. Try not to be in any enclosed spaces in terms of gyms. I still don't go to the gym. I work out at home because I think the risk is still too high to be in a gym. I know most of the churches are still closed, so virtual meetings. And I think that's the most important thing, just trying to limit the spread, wearing your mask when you're out in public, no gloves, and good hand washing. That's about all I have.
All right. Thanks, Dr. Sandra Banks, for an excellent presentation. Now we will hear from Dr. Donwa Simpkins.
Okay, so I'm going to start just really briefly by just touching on some things related to chronic conditions, and then I'll switch over to sort of what I think patients and their family members can expect once you're admitted to the hospital, because that's more of where I'm involved. So I like to talk about chronic conditions because I really feel strongly that this is the time as African Americans that we really have to manage our chronic conditions. We know that patients with obesity, hypertension, and diabetes get coronavirus more often, or becoming positive, have positive tests, I should say, more often. And also, just from my experience in the ICU, more of my patients had hypertension, diabetes, and obesity. So now, just because we are in our homes, the doctor's offices are still open. The hospitals are still open. This is time to manage your chronic conditions so that your body can help fight coronavirus if you do get it. And I also like to bring this up because in the months of May and June, we did see an influx of patients coming to the hospitals when things had gotten too bad. Patients who had let fractures go for days because they were afraid that they would get coronavirus in the hospital. And I don't want people to be afraid of that. Yes, there is a possibility that you could get coronavirus in the hospital, but we really are doing everything that we can to make sure you don't. So please, if you need medical care, come to the hospital and take care of those chronic conditions so that you can fight the virus if you do get it. And that also means getting all the recommended vaccines. You can have coronavirus and the flu at the same time. And Wilhelmina knows I like to tell people that. You can get both of them at the same time. And if you reach the point where you're having to see someone like me, an anesthesiologist, that means that your lungs can no longer fight, or your lungs can no longer do what they have to do. And it's harder for us to treat you if you have two viruses at the same time. So do what you can to protect yourself so that you don't have to come to the ICU and see someone like me. The other thing is, if you needed an elective surgery, hospitals are open. Please, and it goes back to chronic conditions, don't delay the care that you need. Give your body everything that it could possibly use to fight the virus if you unfortunately. So if you need cancer care, if you need help with managing your diabetes, don't put those things off. And so now I'll switch gears a little bit. And if you do have to come to the hospital, what can you expect if you are a patient? If you're coming to the hospital and you're getting admitted, you're likely being admitted because you need oxygen. That means that you will have something on your face. Quite frequently, I would interact with patients and they're like, I don't like things on my face. It's oxygen, you need it. That's why you're there. So if you are getting admitted to the hospital, prepare yourself to have something in your nose or covering your nose and your mouth. Also, I've noticed that the disease was extremely, extremely fatiguing, and that coupled with the isolation that some patients felt because they were coronavirus positive. Healthcare workers weren't spending as much time in their rooms, and they were isolated from their family members. And I think that it was a combination of maybe some fatigue and just, I don't like to use the word depression prematurely, so I'll say adjustment disorder. And patients just weren't at times motivated to do things to fight the virus. And what that means when you're in the hospital, you're going to be tired. You're going to be strapped to oxygen. When physical therapy comes, you have to move. You have to move. You have to take deep breaths. We're going to ask you to turn and lay on your belly. The proning that you've heard about is going to be hard. It's going to be difficult, but it's important, and it helps your body use oxygen more effectively. And when we ask you to lay on your belly and prone, if you have to come to the hospital, you're going to be on your belly for hours. It's going to be hard, but it can quite literally prevent you from coming to the ICU and getting a breathing tube. It's going to be emotionally and physically hard, but those are the things similar to doing what you can to not get the virus and to manage your chronic conditions before you get to the hospital. If you can do these things when you're in the hospital, then maybe you cannot come to the ICU and you can get out of the hospital sooner. To transition a little bit to what families can expect, you should expect a daily update. Your family member may have multiple specialists involved in their care, infectious disease doctors, in the internal medicine doctors, but you should expect an update daily from a healthcare member. The plan of your family member's care, you should get that every day. Just taking notes. That way you can always go back to your notes and say, well, so-and-so said that this was going to happen yesterday. Did that happen? If it didn't happen, why not? Be involved, be engaged, ask us questions. Your family member, like I said, is likely very fatigued. They're tired. They're fighting. Their body is fighting. Ask those questions and advocate for them. Once someone comes to the ICU, expect that they're coming to the ICU, the intensive care unit, because they're going to get a breathing tube. What that means is they will no longer be communicating with you. That's when you really, really have to say, I want the daily plan. I need to speak to someone every day, because your family member is no longer communicating at all most of the time when they're in the ICU because they are intubated. Once the person is in the ICU and intubated, so a member of the ICU team will often ask, what are their wishes? And this is really, really important for me because prior to the coronavirus, and I finished training in 2018, so I've only been practicing for 2 years, but also because of that, my ICU, the time I spent in the ICU is very fresh in my memory. And prior to the coronavirus, I've never had so many conversations about a patient's wishes. And what that means is, does your loved one want to be intubated? How long do they want to be on a ventilator, a breathing machine? And when I say intubated, do they want a breathing tube? How long would they want the breathing tube? How long would they want to be on a breathing machine? Would they want chest compressions? Would they want to be put on dialysis? And all of these are things that happen quite commonly with coronavirus patients. And as patients get sicker in the ICU, we call family members and we have these conversations, and oftentimes they don't know the answers. If there is someone in your family who's at high risk of getting the coronavirus and high risk of getting sick from the coronavirus, meaning that they have pre-existing lung conditions or pre-existing conditions that weaken their immune system, unfortunately, these are the difficult conversations that need to be had. Because you as the family member, you don't want to make that decision for them. What you want to do is know their wishes, so you can simply convey to us what they would want. And I think that's, I really, really want to impress upon people, have those conversations. Know what your family members want. It really makes the process emotionally easier for the person who's having to make those decisions. Once you're in the ICU, your loved one is in the ICU, it may not be a quick course. Quite commonly, patients, once they reach the point of requiring ICU care, you're there for weeks. You may be there for a month. Again, don't get tired. Expect those daily phone calls. If your loved one is there for 2 weeks, that means you should have got a phone call every day. 14 days, someone should have called you. If your loved one is in the ICU for an extended period of time, it is not uncommon for us to move the breathing tube to their neck and place a feeding tube in their stomach. And I bring these things up because, again, we are doing these things quite commonly. This isn't rare. This is something that, because of coronavirus, is happening quite commonly in the hospitals. Mm-hmm. And that's why it's extremely important for you to know what your loved one would want. And that's really all that I have. I know that mine is a little bit different, but I don't treat patients outside of the hospital. So I've only seen individuals once they require care within the hospital.
Thank you so very much, Dr. Simpkins, for that wonderful presentation. I just want to take the time to thank each and every one of you for everything that you do. Thank you for your service to our communities, our family and friends. And I just pray that we all just continue to work together as a team to fight and combat COVID-19, and just saying that we will overcome this. Now we will open the floor for questions. So our SCEDA board member, Brenda Boswell, will read questions from the group chat. Ms. Boswell, unmute your mic.
There we go. Good morning, everyone. What an informative discussion we had this morning. I'll start from the top of the questions we received in the chat. The first one was for Leslie Jefferson, and the question was, do you help customers develop a diet or nutrition plan, and do we inquire online or through the pharmacy?
Hi, yes. You can reach out to me directly. I put my email address in the chat. We don't provide a meal plan, like eat this on Tuesday, eat this on Wednesday. I find that people get bored and they don't stick to it. So we find a way to help you with the foods that you enjoy, and we help you make that a part of your meal plan. But you can reach out to me directly, leslie.jefferson@giantfood.com, and I'm happy to help you there. I also have a private practice. It's called Properly Aligned, and you can reach out to me directly. I take different insurance. So that's lesliej@properlyaligned.com, and I'll put that in the chat also.
All right, thank you. The next question comes from Wanda Tucker. Dr. Allen, so many people are already apprehensive about the vaccine and it's not even available yet. How would you respond to these concerns? And then she has a follow-up question as well.
So I would say, I am, listening to or reading different information from well-researched people that I trust, like say the Academy of Family Medicine or the CDC, and the people who are conducting and overseeing the FDA, the vaccines, to see what kind of information that they are finding out as it goes. So sometimes, like if you're not familiar with doing research or reading science, you might hear one thing one week, and then the next week they say, "Oh no, we don't agree with that." Say, well, Amina mentioned about it first. We thought that Motrin was harmful, and then with research and observation, they found that it was okay to take it. So you might it changes as it goes. That's just the nature of research. So you just have to be abreast and, stay well informed and use reputable resources as far as where you're getting your source of information from.
Right, thank you. All right, another question from Wanda Tucker was for Dr. Banks. And what about eating out of restaurants? Is that a greater risk?
So definitely a greater risk if they're not doing social distancing. So most restaurants that are on phase 2, which I think is what Prince George's County is still on, unless we've gotten into the newer phase, they have seating that's limited. So more than 6 feet distance. When I eat out personally, I eat out outside dining, or making sure that I'm not on top of each other. So there's still an increased risk, but if they're socially isolating and distancing like they're supposed to, especially in Maryland, then I think it's actually okay to eat out.
Thank you. And we have another question for Dr. Banks. Do you recommend more testing in the Black Hispanic communities, regardless of how you're feeling or whether you think you've been exposed?
So that's a very good question. And yes, I actually do recommend more testing in African American, Hispanic, and especially because I don't know if anybody touched on some of the treatment therapies in terms of the new, well, not new, but the antiviral, the redisvimir, which I'm probably mispronouncing. You have to have a positive test and you have to have symptoms or testing within 10 days to actually be able to opt into the trial to get that medication. And so I think you need to have more testing, one, so you're aware of your status, especially because we have higher incidences of hypertension, diabetes, congestive heart failure, things like that. So it makes us at higher risk for having more severe COVID symptoms and even death. So I definitely recommend increased testing in our communities.
Okay, and this is a statement from Vanessa to everyone, where she tries to keep up to date with the data and research and shares it with her patients as she learns about it and lets them know the nature of the research as the data changes. Do you want to elaborate on that, Vanessa?
No, that was just a comment to the previous question. It was just the answer.
All right. Okay, and this is a question from Curtis Steen to any of the doctors. What is science indicating about the possible reasons for the COVID virus seeming to increase with the coming of the cold weather? Is this going to continue like the flu does in the future? And please address the now known future side effects of having had COVID. And it's for any doctor to answer.
So I had just put in the comment box about the challenge for me would be able to tell the difference between the flu infection versus a corona infection. And even for patients themselves, how will they know? So, like I said, both the flu is usually quick onset, is usually you feel, you have body aches and pains and you ache all over. Maybe with the coronavirus, there might be more of a cough in addition to the fever, the sense of loss of taste and smell. Whereas with the basic flu, you just have more of the body aches and chills, not so much cough. And you don't really have the upper respiratory symptoms, maybe with the congestion and, productive cough or producing mucus or something like that. But it will be a challenge. And I do anticipate that, with the winter season, that before when we knew about the coronavirus, we didn't really get the full effect of it till the spring. And the flu season was kind of wearing, it was kind of, calming down during that time. But this time they all might coincide together. And so it will be a huge challenge. And then the healthcare system might be overwhelmed again with people who got sick from the flu, plus people who got sick from the coronavirus. So that's why I think it's more important this time to get the flu vaccine, so you can at least rule that out. And then the hospitals won't be so overwhelmed with flu patients as well as the coronavirus patients.
Okay. The last part of her question was, she asked you to address the now known future side effects of having had COVID.
So I'm going to chime in on that part. I read an interesting article. It's a young lady. She was 24. She wasn't sure how she ended up getting the coronavirus, but prior to getting the COVID or coronavirus, she used to be a marathon runner. She said she would run 6 to 8 miles a day just in training. After being hospitalized, intubated, getting extubated, she now says she can't walk up a flight of stairs without stopping and pausing. So that's one of the long-term sequelae, is the damage to the lungs. A lot of patients that have had corona and have survived have a lot of long-term pulmonary problems. So asthma, bronchitis, chronic lung issues. Wilhelmina touched briefly on the clotting situation. One of my patients that I intubated came in with stroke symptoms. And later we found out he was positive for coronavirus, and he died a week later, unfortunately. But his only symptom was that he couldn't move his left arm and leg. He didn't have any cough, he didn't have any fevers, he didn't have any chills, but he ended up having stroke without any signs of a stroke until later on his MRI. And then I've had a lot of patients that have had pulmonary emboli, some that have survived, some that have died. So I think some of the long-term effects, we don't know in terms of some of the microvascular, so are they going to have chronic peripheral vascular disease? We definitely know the long-term effects from the lungs is a big issue.
And just really briefly, we've seen it attack the heart too. It's called viral myocarditis, but all that means is the virus attacks the muscle of the heart. And so essentially you have fairly 40-year-old, 30-year-old people who are now having congestive heart failure. So it's better to just be safe and cautious. And to answer the first part of your question, I don't know exactly why it's more prevalent in the winter months, just like the flu, but I would suspect it's just because people are coughing more, there are more runny noses, so there's just more opportunity to shed and spread the virus.
And I think, like you said, and people are in closed areas too in the wintertime. They're usually not out and about doing outdoor activities, so they're in enclosed environments. Like you said, and they're shedding the virus with respiratory droplets. I think that's the issue. And then I think you touched briefly, I'm concerned too with the flu co-infection. How are we going to see numbers? Our numbers are already increasing now because the weather's getting cooler and we're starting to get positive influenza cases. And so I am concerned that's going to overwhelm our hospital systems later in the fall. We used to be on red diversion, which meant that we had no ICU beds, no telemetry beds. We were on red diversion for almost 2 weeks straight. And so I think we're going to have the same issue, unfortunately, in the fall, going into the winter season, that our hospital systems are going to be overwhelmed again.
All right, thank you. And our next question is there any way to know other than testing if a person is asymptomatic?
No.
Not at all.
No, you have to be tested. I mean, if you don't have any symptoms, even people that have certain symptoms, they're probably not everybody's going to be positive COVID. Somebody might just have influenza, or they just might have a rhinovirus. So without testing, you're not going to know if you're positive or not, especially without symptoms.
All right, thank you. And then the last question that we have in the chat is, what has been the annual death rate from the flu in the past years?
So usually the annual death rate can go up to like 45 to 55,000 per year from complications of the flu virus and ending up in death.
And I don't know the annual death rate from the flu, but I hear this conversation a lot about the flu. It's just the same as the flu, and it's not. And I'm not a critical care doctor. I'm not an ICU doctor, but I'm close enough to my training that I've spent winter months in the ICU. And you typically would have maybe 2-3 patients in the ICU from the flu, healthy 40, 50-year-olds. They just, for some reason, their lungs couldn't handle it. This disease is much different. We've never, ever, ever had an ICU full of flu patients. We've never had to create additional ICUs in the hospitals because of the flu. Don't believe it. They are not the same.
All right. I'll turn it back over to you. Thank you.
You're welcome. So does anyone have any additional questions? If you would like to ask a question, you can unmute yourself and proceed with your question.
I have a question. So you mentioned before that there are some underlying conditions or things that heart disease and lung issues that can develop after COVID. Is there anything that can be done about that during the treatment? I know that a lot of people that are asymptomatic will stay in for their 14 days, go back and see their doctor, and they never have to take any medication other than over-the-counter cold medicine. Is there anything that they should be taking to prevent these things from happening in the long run?
I would defer to the other physicians, but they're just thinking about the natural course of a virus in the body. There's nothing that I can think of that you could do other than us getting a vaccine and getting a medicine to prevent the virus from replicating in the body. There's not. Just know that just because you felt good on day 7 and day 10, don't discount how you may feel on day 14 or even 15 or 16. And then that way you can get yourself to medical care sooner. But I can't think of anything you could be taking.
I agree. I echo that too.
I think since there isn't a treatment unless you're really sick in the hospital where you're getting some of the newer medications mostly, I think what the other two presenters said about preventive measures, like trying to boost your immune system and doing things to keep your body healthy like you would do during a winter anyway. So, taking those extra supplements like a good multivitamin, which would include your antioxidants, your vitamin C, A, D, and E, doing omega-3 fatty acids. And because you are inside, the vitamin D does have antiviral properties. It also is immune stimulating. So like I said, if you had to take anything, maybe take a good multivitamin, omega-3 fatty acids, and vitamin D. And that would be enough. And like I said, for me personally, I take extra doses of vitamin C and vitamin D throughout the winter months. And, and this time I think I started at the end of summer, and I'll probably continue it indefinitely while, we're going through this.
Can you all hear me? I had another question. I was wondering, since during the summertime, it seemed as though, I'm not saying the virus wasn't affecting people or anything, but everyone was sort of like, get outside the house so you can get outside of the confines of whatever space you're staying in. Is that so? Would you say that though it's getting colder, that we should try to get out of the house for a period of time every day during the winter too?
Yes.
Yeah. I think outdoor activity is good. Even though, maybe it's not sunny all the time, but it's outdoor activity and cardio activity. I think things that we can do to boost our immune system. So eating healthy, taking multivitamins, doing activity so you're not sedentary. Those are the things that are going to be the key. And definitely outdoor activities, are just good for your spirit, for your body, for your mind. So I definitely think that should be the key. Using precaution and warm weather gear.
I would definitely agree with that. Going outside can, even for 15 minutes, can really do a lot. I mean, we take it for granted because it's just outside, but focusing on something other than your own four walls, it can do a lot for you. It's just the brain receives those signals, and then you're able to kind of take that energy in. It's more about the energy of being outside and it gives you a sense of accomplishment. It gives you something else to focus on. I'm going to walk to the corner. That gives you something else to focus on other than, all that's going on. It's not just COVID, right? There's a lot impacting us. So stress can have a big impact on our immune system. And we want to make sure that we're doing other things to make sure we're keeping ourselves happy and healthy.
Any additional questions?
So just about everybody in my family is asthmatic. Would you recommend the flu shot and the pneumonia vaccine?
Definitely, yes.
And how often should we be getting the pneumonia vaccine? Because it's been years.
It depends. It depends on how often your doctor wants you to receive it. A lot of doctors will try to say that you need the pneumonia shot every 5 years, but your flu shot you definitely need every year. Once you turn 50, if you haven't had a pneumonia shot, I recommend that you get the influenza and pneumonia shot. For our patients that turn 65, we usually give them the Prevnar 13 shot at that time, and then 12 months later, it'll be followed by the Pneumovax 23 to give them better coverage.
And if you have high risk illnesses like asthma or COPD, or diabetics, then they are also considered to do the pneumonia vaccine sooner, as
Yes.
well as everybody is, is advised to do the flu shot.
Dr. Allen, can you tell us about your wellness program in your book?
So with my wellness program, it has taken many shapes and over the years, depending on what patients want to do. Initially, I started out just focusing on weight loss because that's what patients mostly ask me for. And then I started incorporating it into other more chronic diseases like high blood pressure and diabetes, and mostly from a holistic perspective of a whole mind, body, spirit, whereas mostly using your food as medicine. So, Leslie had said about, your plate should look like a party. You should have a whole lot of different colors on the plate, and it should be alive, have something living in your plate and your diet every day. And then, taking the time to relax, doing some meditation, doing some set aside time for yourself. Because now people work at home. They tell me I work even harder and longer than when I was in my office. And it's like that movie, like, every day I do the same thing every day and nothing changes. And then then as far as your, we talked about mind, body, spirit. And so those are the whole, the basics of trying to do a wellness lifestyle. So as far as like diabetes and high blood pressure, again, it's diet. If you can address a lot of the dietary concerns, a lot of the other parts of your disease do get better. Now, there's some things you can't change, which might be genetics, but that might be 50%. But the rest of it is lifestyle. So focusing on how can I eat better? How can I exercise? How can I incorporate, if I do 20 minutes of physical activity, just getting out and doing 20 minutes of getting 20 minutes of natural sunshine, and then doing like 20 to 30 minutes of physical activity at least 5 days a week. That's half your battle. And then my book came out, like I said, from my patients asking me about how can I lose weight without having to take medications and, not having to eat something that I really know I can't maintain for the rest of my life. So instead of just looking at it as a diet, look at it, this is how I got to eat for the rest of my life in order to not get diabetes, heart disease, stroke, things like that. So again, approaching it from a whole mind, body, spirit. I started out with an elimination diet. Like, you might be taking things in that are really good for you, but they're making you sick. And so taking those things out of your diet to see, do I feel better? Am I, did a lot of my GI problems like gas and bloating go away? And then, I mostly at that time, the book was where I mostly focused on a low carb diet because I felt like it would accommodate the diabetics and the patients who had hypertension and heart disease. So doing a low carb diet is a good way to implement it. And then taking that time out every day to incorporate meditation and relaxation type exercises and having like a positive message. Because if you start your day like, oh my God, I gotta have so much work to do, that's how your day is gonna be. So if you set the tone for the day with a positive message, then, you can, pretty much, go through your day without feeling so stressed, even if you have stressful things you have to address. And then ending the day with taking time to relax and exhale and allowing your body to relax as well so that you can get a more restful sleep. And, trying to get that 8 hours of sleep is very hard, especially as you're getting older. You think like, oh, as I get older, I just don't sleep. That's not normal, but it is harder to get those 8 hours of restful sleep. And so the combination of eating better, sleeping better, incorporating physical activity is going to give you that sustained weight loss that you want, not just a quick fix.
Any other questions?
So what's the title of your book?
It's called The Natural Way.
And
the way is WEIGH.
So where do you get it?
You can get it on Amazon.
Natural Way.
Dr. Allen, I have a question for you. I refer a lot of my patients to a book called Eating Right for Your Blood Type. In doing holistic medicine or treatment, do you refer to the blood type specific, blood types like A, O,
well,
as far as what they
eat? Around a long time, and it
Yes,
recirculates about every 10 years. Somebody will come back and say eating for your blood type. So I think that when the book first came out, it probably didn't have the technology to support the reasons why your blood type might have something to do with your diet. I think that it's still not quite there yet, but I think they are doing more gene studies that show that, maybe as they develop new drugs, this drug might be more specific for based on some type of genetic makeup. So I think that technology is there, but I can't say that I would say that based on a specific blood type, this certain diet would work best for you. But I do think that blood type is genetically coded. So there probably is some link, but I can't say right now that all the data supports it
Okay.
at this
thanks.
time.
Any other questions? No. Okay, so now I would like to introduce Linda Thomas. She is our SCEDA Legislation Affairs Committee Chairperson.
Believe that Linda, have you returned? Hi, this is Jim Borland. I'm a part of I'm on the Political Action and Zoning Committee, Legislative and Zoning Committee, and I will speak for her. She had to go attend another meeting.
Okay.
Okay. Prince George's County, as you might know, is on the verge of entering into an alternative financing public-private partnership. It's known as P3 for the construction of 6 middle schools. It is proposed that the P3 will utilize private capital, and the 30-year corporate contract will include financing, construction, operation, and maintenance, and capital repair and replacement of these schools. The properties will be handed back to the school system at the end of 30 years. The total cost of the contract is expected to be around $1 billion. Now, the concerns that we have, first, let me say, first such project in the United States. B, requires $15 million a year from the county council's budget. C, no public value for money analysis review. D, winner won on cost and not on quality. And E, a complex contract. F, profit for the investors will vary. So that's a meeting that they had recently, and what they've decided to do is on the 24th, they postponed everything until the 24th of this month, which is next week, and they're supposed to have another meeting. There's some concerns that we have with the who's going to pay for not for this thing. This is $1 billion, but $15 million will have to be paid up by the county up front. Could everyone hear me?
Yes.
Oh, okay. That's all that I have.
Thank you, Jim. Can you hear us, Wilhelmina?
Yes, I can.
All right, so now we're ready to move on. If any of you are interested in joining SCEDA, you can do so through our website, SCEDAinc.org. We have individual memberships as well as business and nonprofit, and of course, lifetime memberships. So now we want to turn the program back over to our Vice President, Ms. Tanya Sweat, to do our closing remarks and adjournment.
There was one other thing too that I omitted.
Okay.
The CEO, Dr. Monica Golston, will host a telephone town hall event to hear from other updates, to offer updates to PGC PES families on the proposed alternative construction finance plan for the following schools: Drew Freedom Middle School, Hinesville Middle School, Kenmore Middle School, Walker Mill Middle School, and new buildings in the Adelphi and southern areas of the county. And the telephone town hall will be held from 6 p.m. to 7 p.m.
Very good. Thank you. Tanya, are you available to close us out now?
Yes, I'm still here. I'm sorry. I was trying not to be the star of the show and trying to make sure I stayed out of the way to allow the good doctors to do what they do. I was so engrossed in listening to the answers and the questions. I didn't realize we were ahead of time. I was hoping this was going to be a little longer. Outstanding job, ladies. Thank you so much. What I can't say thank you enough. And before we go, there's another group of people that I have to thank. I can't ever forget to thank them, and that's our board of directors. And I'm going to ask those who are on the line at this moment to just open your mic for a minute and introduce yourself to us and bring greetings. And we will start with, I'm looking, Madam Program Chair has already introduced herself. I'm going to start with Mr. Jim Boardley. Please introduce yourself as a board member for SCEDA, and then we'll go in order from there.
Good morning, everyone. My name is James Earl Jones. My name is Jim Boardley, and I've been with SCEDA for a few years now, I guess around 13 years. Started off as the chair of the Business Relations Committee, and then as Legislative Committee chair. Just enjoy being with the organization and trying to learn as much as I possibly can and educate others as to what's happening in the areas that I've been working in. Thank you. That's all I have.
Thank you, Mr. Boardley. Membership and Hospitality Chair, Ms. Curtis-Dean Boardley, please introduce yourself.
Oh, okay. Well, good morning. My name, again, is Curtis-Dean Boardley, and I've been a member of SCEDA for, I think it's a little more, about 10 years, maybe about 10 years. And I have been serving as the chairperson for the Membership and Hospitality Committee, and looking for opportunity, looking for people who want to join that committee and help us out with that more. SCEDA has been a good organization to be a member of in terms of staying abreast of what's happening in our community. And I hope we can do a little bit more about ensuring some accountability, and hopefully we can share the information regarding the upcoming calls about these, working through a private enterprise to build schools. Because if we're going to do that, I know one thing, you've got to have some experts in the school system who are going to track what these people are doing every day. That's it.
Thank you, ma'am. Mr. Edward Williams, Jr.
Good morning, everyone. My name is Edward Williams, Jr., the son of Edward Williams, Sr., PA. He couldn't stay because he had a current meeting. I'm a board member of SCEDA. I've been involved about maybe 2 years, and it's interesting, and I deeply appreciate the vital information that's being received at each and every event that we have. And I just want to say thanks, everyone, for being involved, and deeply appreciate you. God bless. Thank you.
Mr. Ken Ford, he's our quiet riot, I call him, on the board. He usually doesn't turn his camera on, but Ken, please introduce yourself to our audience.
Good morning, everyone. I'm Ken Ford. I'm the tech guy that's behind the scenes here today. You all on YouTube and also being recorded. I'm usually the one that if your microphone gets a little sound coming from your stage, I'm the one that will mute you. And that's, I don't really know too much. I've been with SCEDA under a year, and I only get all my information from Jim Bortley. So that's who I usually ask. Thank you.
Thank you, Ken. Miss Esther Williams, would you please introduce yourself? I see you, I think your camera's off too, but please say hello.
Hello, everyone. Good morning. My name is Esther Williams. I have been with SCEDA for about 5 years now. I am also the executive director of SEED, which is the arm, 501c3 arm of SCEDA. I really enjoyed this information today. I bring you greetings from New Orleans. We have had some interesting and very knowledgeable information today and with our other general meetings. And I look forward to the next general meeting as well. You all have a great one. Be blessed and stay safe.
Okay. You too.
You too.
You too.
And we pray for your safe return home, Esther. Mr. Earl O'Neill, please introduce yourself to our audience.
Go to bring the boss room. Not there.
I see Mr. O'Neill. He's our Education and Youth Affairs Committee chairperson and has been a longtime member of SCEDA. He was also our immediate past president. And so we thank him for being with us today and welcome him to our general meeting. And I think Ms. Caroline Wills Anderson is on the phone.
Yes. Good morning, Tanya, and good morning, everyone. First of all, let me also echo the thanks and appreciation to the speakers. I'm very much a person that's into health, so I can appreciate the variety of the information that has come to us this morning, and it couldn't be more timely or more on point in terms of what we're all dealing with the pandemic and the other kind of health circumstances. So thank all of you panelists. You've just been an absolute treasure for the SCEDA community this morning. I've been a member of SCEDA for about 20 some years. So I've served in most positions, starting with secretary. I've been the correspondence secretary and right on up to the president of the organization for a term. And so just and serving in major roles, I've benefited so much by the service myself because, you know, SCEDA is an organization that helps us to take care of our own community. So the services that we contribute to it are really services we're doing for ourselves as well as our neighbors to have a great community to live in. So one couldn't do anything any more precious in terms of serving both your neighbors, your family, and yourself than to really roll up your sleeves and be a part of whatever we can do to make Prince George's County and other surrounding counties a great place to live in. And you can judge that for yourself for the quality of the information we're even giving out this morning, and something that's so present to each one of us and so significant. So I thank you, Tanya, for being there for being there for Jane and giving her, echoing her sentiments to everyone that's participated today. And thank you again for the opportunity just to share. I also serve as on the board of SCEDA, and I'm also chair of the board for SEED, as Esther Williams spoke to you about, the companion 50C3 organization, 501c3 organization for SCEDA. We work together, and through SEED, we're able to do some of the things, the charitable arm that SCEDA more or less takes care of those things like a board of trade and the things that we can testify to. But working together, we have the back of the hand and the front of the hand that can do whatever we as a community want to charge the people who work for us in government, in political positions and whatever. We're the ones who hold them accountable to bring good services to us when we put them in office. So thank you, Tanya, for the opportunity to share for a few minutes.
And thank you, ma'am. We appreciate your leadership and your contributions, long-standing contributions to this organization. I also want to recommend in their absence a few other board members. Ms. Linda Thornton Thomas is our Legislative Affairs and Zoning Committee Chair. She actually had to leave us a little early today because she's going to do more work for SCEDA in another meeting. But I did not want to overlook her and what she does for us, because she monitors legislative actions and make sure we are aware of what's happening in General Assembly and in the County Council. I also want to recognize my husband, who is our Public Safety Committee Chair. He had to step away to spend a little time with our son, who's away at college, on the phone. Mr. Terry Sweat, he's our Public Safety Committee Chair. One other chair who's not with us today, he may be watching on YouTube, Mr. Zeno St. Cyr, who is our Transportation Committee Chair. And we thank him for his longstanding service as a member of SCEDA. Now, there are some other faces who've already spoken to you who are on our board. I did not forget those beautiful faces because I just wanted to recognize those who had not spoken yet today. I'm gonna go back now to those who have already introduced themselves to you. You may hear from them again, but I wanna make sure I recognize everybody on our board. Ms. Brenda Bosware, well, our question facilitator, can you bring us greetings, please?
All right, thank you, Tanya. And I know you didn't forget about me. I also want to echo the sentiments about the speakers. This was a very informative session, and I thank you so much for taking out your time over this weekend to come and speak to us, to educate us, and to inform us. I have been a member of SCEDA for just a few years and happy to be a new member to the board. And thank you again, and that's all I've got.
Thank you, Ms. Boswell. Chaplain Hood, can you bring us greetings, please?
Yes. I am thankful to serve as chaplain for SCEDA and have served over a period of about 10 years, and I've also been a board member. And I want to make one comment concerning the overall meeting and what I believe will be a far-reaching impact. At the beginning of the meeting, as we know, Dr. Wilhelmina Taylor gave us an overview. And one key thing among many that she said pray. But but in addition to that, she mentioned the health issue, the medical side of the equation, the physical side. So I was so impressed and so moved by that, simply because in the trinity of our person, we are two-thirds natural. And so we cannot spiritualize everything. There are things that we must do based on science, and listen to the advice of those who have achieved in science, achieved through study. And so I'm eternally grateful for each individual who's participated and who over the years spent their time and attention and developed their knowledge and their skill set in order to be able to advise us. We are in a war. We see the title, combat. And so we have an alliance of people, a cadre, a nucleus of people who are not going to call retreat and who are going to listen to science plus ask God's wisdom. So we invoke the presence of God, ask for his help, because we know that we are finite, but he's infinite. So the finite and the infinite must work together. And our first line of defense against the virus in this war is our attention to God, and then who's given us the power to do things that will combat and then overcome this coronavirus war that we are in. So I'm eternally grateful for those who spoke about nutrition, our physical body. We cannot work or do anything spiritually without a natural body to work in, and the medicine that the treatment that's been rendered by the doctors and those that person who was in anesthesiology who work and see people on a regular basis now. My prayer is that they will not internalize the sickness or the devastating conditions that the people who come needing help, that they will not be a burden to them, that they can perform their duties and then go home knowing that they can sleep well because they've done their due diligence. So I'm just thankful. This is a meeting that's going to have impact, far-reaching, I believe, because not only are we meeting here and we are listening, but it's what we're going to do when we leave here. Go and put into practice those things that we've been reminded of. So thank you for the time that you've given me to share this with you. Okay, can you hear me?
Yes.
Yes, thank you, Mr. Hood.
Yes, thank you very much, Mr. Hood. And I almost forgot one other person I need to mention, our recording secretary, Miss June Brown. And I need to check on her because I haven't heard from her in a while. I'm praying that all is well with her, but we wanted to acknowledge her work with SCEDA as well, because she served with us for many years. And the last person, but not the least on our board, Dr. Wilhelmina Taylor, you've been the key to today's activities, and we've heard from you already, but please bring greetings once more to our audience.
Hi, yes, I am Dr. Wilhelmina Taylor, clinical pharmacist, and I am a SCEDA board member. I'm the chair of the Healthcare Actions Committee. And I've been with SCEDA for about 2 to 3 years. I've been sitting in on a lot of meetings for maybe about a year or so before I joined. But this has truly been an exciting and a wonderful group that I have joined. And I just thank you for all of the work that you all do. And I'm just trying to help our community and help our families and friends just to move forward and educate them and to help them in any situation that we can help them with. And I just thank you for allowing me to be a part of your great committee.
Thank you.
Hey, Tanya, can you hear me?
Yes.
Yes, we can hear
Okay,
you.
that was one point. If that's the last person, I didn't want to supersede anybody, but there was one point I did want to share. One of the doctors raised the matter of being prepared in terms of if you get sick or something, having somebody that you have named to give power of attorney to.
Urgent
but
care.
They didn't necessarily mention giving them, yes, being on a ventilator, how long if you want to do that, or you want to be resuscitated. The way to do that is you should check with your legal person, if you have one, about having a power of attorney for health care. That is important. That will give the power to somebody up front now, and I don't care how young you are. You need that along with the will, basic things. Or you can do a living will, which you make the decision and you tell the doctor. And that should be something in your repertoire of your papers and things that you keep. So if you do get sick, you've already made those decisions about how you want to take care of your personal business and pre-needs as well. So I just wanted to mention that I am a practicing attorney in probate. Been working in that for a long time. So downsizing now, but I just wanted to bring that information because that sparked that when the doctor did mention about making those decisions up front. It's never too early. Okay, thanks, Tanya.
Thank you. Ms. Anderson, Wills Anderson, I messed that up, sorry, is an attorney.
That's
so
okay.
It's always nice to get free legal advice. Did we have any other announcements, Madam Program Chair?
That is it, other than to announce our next meeting on November, I was going to say 17th, but I believe it's November 12th.
Okay, the third Saturday in November, and I think Dr. Taylor is going to give us another excellent presentation on healthcare related to COVID and the flu season and what we need to know just in case our babies go back to school. We don't know yet, but we're going to plan for it and be ready just in case. And Madam Program Chair,
Yes, ma'am.
I want to give you the biggest virtual hug that I can give you.
Yay.
Thank you for what you do for the CEDA
Yes.
board.
Yes. Thank
You
you.
started us off, and you have been phenomenal in
Yes.
coordinating some excellent programs so far this fiscal year. Please keep up the good work because you make us all look good. And I want to thank you for what you do. I didn't forget you. I love you. I wanted you to be like in my closing and give you the big shout out that you deserve. And I want to thank our audience for being here. None of this matters if you don't show up to get the information that we have to offer. And Ms. Wenda Tucker is working her behind off, coordinating with our committee chairs and with our community leaders to bring some wonderful information. So please, please, please let the county, let the state, let the world know what SCEDA is doing and invite others to join us on the third Saturday of next month. We won't be here in December. It's Christmas holidays, but the third Saturday of the month, generally, we give you another excellent presentation. And with that, I'm gonna do what normally I wouldn't do. I'm gonna turn this program back over to the lady of the day, our program chair, to close us out. And I'll let her do it in her own way because she's the star today. And I thank her for what she's doing. And Dr. Taylor, I thank you again because you really, really awesome program and you've made SCEDA look good. I appreciate you, ladies.
Well, I want to thank Dr. Taylor. She's a dear friend of mine, but I just want to thank her for all the time and attention she's put to pulling this together. She pulled together all of the speakers, and we had a few drop out at the last minute, but we were able to pull a few more in. But thank you so much for doing what you've done for us for this meeting, and you've already helped us plan for November. So, and thank everyone, Mr. Hood, Tanya, Esther, Ken, everyone is always available to keep these Zoom communication meetings going smoothly. So thank you so much. And we will see you all next month, November 21st. All right. Have a wonderful weekend.
All righty. Thanks. Everyone be safe.
Thank you
Bye-bye.
all so much.
Bye-bye. Thank
Bye-bye.
you.
Thank you all so much.
There's a